Hi, my name is Jimmy Pizarro. I'm a respiratory care student here in Miami-Dade, and I'm going to teach you how to do incentive spirometry. Objective for incentive spirometry is to prevent and treat atelectasis. Indications for incentive spirometry are presence of atelectasis, presence of restrictive lung defects, upper abdominal and thoracic surgery, spinal cord injury, abdominal binders, and thoracic and abdominal pain. Counterindications for incentive spirometry are patient's inability to sustain maximum inspiration, lack of cooperation, inability of patient to take in a deep breath of vital capacity that is less than 10 milliliters per kilogram, or an inspiratory capacity that is 1/3 of the predicted normal. Hazards and complications of incentive spirometry are ineffective technique, hyperventilation, exacerbation of bronchospasms, hypoxemia, and fatigue. Now I'm going to walk you through the steps on how to do incentive spirometry. First thing you're going to do is knock on the patient's door. You're going to verify the physician's orders. You're going to identify the patient. I'm going to introduce myself to the patient, and then I'm going to tell the patient that I'm going to go wash my hands, and then come back. You wash your hands. Put on your gloves. Okay, at this point you already have your spirometer and your filter. Then you're going to take the patient's vital signs, which include respiratory rate, heart rate, breath sounds, and saturation. Now I'm going to demonstrate how to do spirometry. What you're going to do is instruct the patient to exhale normally, take a deep, slow breath, and then hold the breath for 5 to 10 seconds, and then exhale normally. What they're supposed to do is maintain this in the middle where the happy face is, and that's the normal flow. Now I'm going to go ahead and have my patient do it for me. All right. Mr. Hernandez, can you? Okay, you're going to exhale normally, then take a deep breath in, and then hold it for 5 to 10 seconds. Okay? And then hold it here in the middle. Good, 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 good. Good. Okay. And the way you determine their volume is each spirometer has their own chart with defines the volume on their height and their age. You always look at that, at this chart, to determine their volumes. Now what I'm going to do is go ahead and take the vital signs afterwards again, which is heart rate, respiratory rate, breath sounds, and saturation. And you have to instruct the patient to do it every 1 hour, at least 6 to 10 breaths if possible. And you record everything that the patient has done so far. And now I'm going to go ahead and take off my gloves, wash my hands. I'm going to chart what the patient's done, and that's it. And